Okay. Hello, everyone, and welcome. Thanks for being here. Welcome to our first quarterly review call for lower extremity best practices. The intention of these quarterly calls is really to engage in productive dialogue and share case stories as they relate to best practices. My name is Nick. I wrote the first version of best practices, and together with Ruth, we'll be moderating these quarterly calls. And I'm going to start with just a brief introduction to share why best practices were created and sort of the role I think they can serve within our, long-term aspiration of transitioning from more of a disease care system to a healthcare system. And we're going to hear from different speakers from different disciplines, and we're going to attempt to get 7 different speakers from 7 different specialties on each of these calls. And I'll make sure to give everyone a 1-minute warning at 6 minutes, just to let them know that their 7 minutes is coming to an end. And I think keeping it concise allows us all to prep and think about what we want to say, and just keep it high signal. And then we're going to do a 15-minute discussion session, more of a Q&A, just informal. If you have questions about best practices or anything to contribute, or even just something to reflect on from what one of the other speakers said, that session will be for that. And then we'll talk about the process of building consensus and what best practices actually means, and why building consensus is an important part of this mission. And then we'll close out the call with the date for our next quarterly review. So again, thanks everyone for being part of this, and for volunteering to speak and share, and for really spearheading the mission to sort of set a higher standard for lower extremity health professionals. So it seems to me that, we're moving through this paradigm shift within the health and wellness space. Our system of disease care mainly focuses on diagnosis of illness and treatment of symptoms, but has very little to do with health, in my opinion. And, to me, healthcare is about helping people restore natural health and function, across all domains. But I guess within our specific domain, we were talking about the physical health realm, musculoskeletal, and the lower body, so belly button and down. And one of my sort of favorite metaphors or ways to think about this at a zoomed out level is this old metaphor that probably a lot of people have heard about, the fish in a tank. And this idea that when a fish tank is full of stagnant, dirty water and the fish are getting sick, I think most of us would agree that it's, changing the water to clean fresh water is probably a better thing to do than trying to constantly diagnose and treat the diseases that each of these fish are developing. And, in that metaphor, water is sort of the way that we live our lives. And I think disease care continues to get much, more advanced and more complex in diagnosing and treating symptoms that are derived from a lifestyle that is sort of the aggregate of behaviors that don't align with our biology. And I think the shift that we can all be part of, and I think that's needed, is really engaging with healthcare. And that is sort of the quest to help people change their water, help people live naturally and in alignment with their biology, and really just understand what exactly that means. I never learned anything about that in my physiotherapy master's degree. And I think one of the ways I'm thinking about best practices, both my brothers work in trades, so I hear a lot about building code. And these are like these foundational rules when you're building a home or a building that you have to abide by. And, this set of guidelines is sort of these set of rules that must be respected by people who are building structures to ensure that whatever is built is safe and won't fall apart and harm people. And to me, best practices are very similar to building code, in that they don't tell professionals how to practice or what to do. Just like the building code doesn't tell trades how to build a building, what tools to use, what methods to use, or what the building actually looks like. They simply highlight essential ingredients that need to be honored in order to uphold a reasonable standard of quality when you're building a structure. And similarly, best practices are sort of these essential practices that need to be applied in order to be effective and to uphold a reasonable standard of care, and do what we're trying to do, which I think is just helping people get healthier, helping people take better care of themselves. So we all have different specialties and methods and tools. So our practices should look drastically different. But as a community of lower extremity health professionals, I think it's important that we find some agreement on the foundational essentials that need to be applied with everyone we work with to ensure we're sort of helping people to our maximal ability, to the best of our ability. So that's it for my intro. I don't know if that clarifies best practices for people who are new to this or have just heard of it. But we're going to go through the speakers now. First speaker is Ruth. So she is helping to moderate these calls. And so Ruth, if you want to kick it off, I'll give you a warning at 6 minutes if you get to there.
Okay.
It's all yours.
Okay, that sounds great. Okay, so I'm going to start by introducing myself. Hello, everyone. I'm Ruth, and I live in the southern United States. Um, what I do for my specialty and my work is I focus on one-on-one and group instruction, movement instruction with an emphasis on guiding people back to trusting themselves and their bodies. And so I do this by primarily teaching people how to become the scientists of their own bodies and the health practices that they use on their path to restoring and maintaining a high quality movement life. And what I do daily to care for my lower extremity health is, in addition to not owning a car for the last 16 years, which eliminates the burden of choice in how I move about the world, switching 100% to natural footwear and eliminating chairs, couches, and beds from my home. I also practice balance and hacky sack training every day for 30 to 60 minutes. And so, by consistently living these practices every day as a part of my life, I don't own a gym membership. I just I live as naturally as I can, moving as naturally as I can, and then adding some fun type of practices. As an athlete, I was injured a lot with a lot of chronic pain and treated. The quality of my movement life was not very good. So, trying to add more fun ways to help rehab and restore my health has been a big part of my life. And I've been able to restore the strength and mobility, adaptability, and resilience and minimize debilitating chronic pain from my lower extremities. Not 100% and not all the time, but enough that the quality of my life has improved drastically. And I'm able to participate in all the activities like tennis and golf and pickleball and getting down on the ground with my nieces and nephews and up and down that I otherwise would not be participating in at this time in my life had I not made these changes in my life. And so, best practices is a really important project in my work because I've been a practitioner and a movement teacher for, I mean, I'm going on 35 years of all different kinds of movement as a movement generalist. And I guess exposing best practices to health professionals and exposing them to the contents inside the best practices pages for lower extremity health is super important to me. So as a practitioner, I find that it's not enough to expose the general public to practices like natural footwear, sitting less, and movement practices like balance training that can restore our lower extremity function to live higher quality of lives. If the health professionals that they trust, the people that I teach, trust their health, um, give their health over to the pros, and the pros that they go to, the people who are the wearing the badges and the jackets, whatever that is, PTs, podiatrists, so on and so forth, if they're not also educating the general public in these areas, which makes it fatiguing as practitioners like me in the movement health field, and burnout in the pro field, where people go to get their fixes for whatever they're working on. So my work with best practices is going to primarily be focused on a call to action for health pros in my city. So this is really my intention on how I'm going to work with best practices in the future. And my plan is to begin building rapport and relationship and community with the health pros in my city. So I'll begin with one specialty at a time. First is going to be podiatrists in my area. There are 18 podiatry practices within a 15-mile radius of my own home. I plan to build relationships with this group of people. And the model will be based on Nick St. Louis' experiment that he offered directly in his neighborhood in Ottawa. So what I'm going to do is I'm going to visit the practices in person, introduce myself, hand out hard copies wherever possible, and send email copies of best practices to the clinics with an invitation to read the paper. Then I invite the pros to a meetup / meet and greet where I'll offer a movement session to expose them to the actual movement patterns and the fun and the balance training and the hacky sack that we use at TFC specifically, and an opportunity to discuss best practices and have a Q&A / networking session. And then outside of that, what I plan to do is offer our schedule of foot health classes and soulmate classes that are held in my general community to the pros so that they can funnel their patients and clients into the community to learn about some of the stuff that we're doing, have some fun along the way to restoring their lower extremity health, and also encourage them to lead by example in their own movement practices. Because a lot of what we know to be true is that people who are working in clinics and practices and prescribing movement and rehab to people aren't actually living those lives themselves. So that is my plan, and that is my talk.
Awesome. Thank you, Ruth. And thanks for, taking it upon yourself to go out into the community and spread the message, not from a viewpoint of necessarily conflict with the old disease care system, but with just hopefully tapping into people's curiosity to see that maybe there's a way you can help people more by just doing small practices that really, I think, can easily be taken for granted. I know for myself, I often take for granted that people understand pain. And what I realized after talking to them is that they, I sort of think that people understand pain in the same way I do. And so I often just skip over going, to the real basics of how I would explain pain to like a 6-year-old. When in reality, and in my experience, what I found is actually most people don't understand pain. And if I don't cover some basic pain education, it ends up being this big obstacle that kind of gets in the way of progress. So thank you, Ruth, for taking it upon yourself to do that and for sharing. And next up is Nick Holt. And Nick, I'll give you a 6-minute warning if and when you get there. So it's all yours.
Okay, awesome. Thanks, Nick. Thanks for sharing all that, Ruth. Good stuff. So yeah, my name is Nick Holt. I live in Costa Rica. I've been here about 15 years, originally from New York, but this is home for me. I'm a personal trainer and health coach by trade. So I have a personal training business that I run in person, one-on-one, that I work with people one-on-one, and then I also work with people remotely in small sort of groups, and also do some sort of consulting and coaching. So yeah, I think the best practices for me, I think I'll give kind of 2 case studies, one on myself and then one on a client who I actually just saw a few hours ago. And yeah, it kind of echoes what you were saying a second ago, Nick, on pain. So I'll start with a client who's in maybe her early 60s, female, and she's had a lot of pain in her foot, and she's been technically diagnosed maybe with some I think it's a peroneal, maybe tendonitis, or she's very, so she has pain in the lateral side of her right foot. And I think the way that I've been using the best practices is really about two things, really. It's educating her about pain. And she came to me with this mindset of, my right foot's injured. I can't do X, Y, and Z. Like, we need to do all these other things and we need to work around it. And I can't walk normally. And there was a lot of this sort of self-limiting sort of talk. And we've been working together now for like 2 or 3 months. And it's, the main sort of best practice that I've been using and implementing is just this idea of pain as a teacher and pain as a signal, and not pain as something that is, bad to be avoided. And, coming from a place of compassion and empathy and saying, yes, this sucks. And, you're not broken and you can do all these things, and look at what we are doing now that we weren't doing 2 months ago. So she's making all this progress. I think that the specifics on pain is what I've had her do, is really take kind of like a daily inventory and a daily log that I know, we talk a lot about over at, the Foot Collective, and a lot of the teaching there is really about getting more specific about the pain. And I think, to your point, Nick, most of the people that I talk to pain about, it's like, oh, it's either it hurts or it doesn't. It's like this binary yes or no. And what I'm trying to really teach and empower her with is this, this ability to tune into it a little bit more, in terms of it. Is it achy? Is it dull? Is it sharp? Is it like, what's the frequency of it? Is it 1 to 10? And, just putting a layer of like precision on it. Because it's, a lot of days she might not be able to, do everything that we have sort of in the workout, but she's definitely making a lot of progress, and we're building kind of capacity in her sort of lower limb, calves, quads, hips. And so it's really been cool to see her trajectory and her sort of transformation, from thinking that she can't do all this stuff to like, okay, I can, and my body's just sending me a signal, and I just need to give my body better inputs. So that's been cool. That's how I've been using best practices on a sort of, from like a coaching perspective. What do I have on the clock, Nick? A couple minutes? Two. Can I get a warning? Can I get a
Sorry,
time?
I was muted. You're at 3 minutes, 20 seconds, so you're still
Okay,
good.
cool. So yeah, on a personal level, I think, I mean, what got me into sort of lower, trying to really understand lower extremity health. Always been an athlete, played competitive basketball. I'm a surfer and tennis player now. I play competitive tennis tournaments, but I've always had these ankles that have been sort of stiff and kind of locked up. It's created a lot of knee pain and sort of hip and low back issues. And the way that personally I've been using the best practices is just really tuning into the inputs, like the whole idea of like, right now I'm dealing with this kind of Achilles, I guess it would be like a tendinopathy, just like some heel pain after I play tennis. And forever I was trying to, find the right physio or find the right, specialist to try to fix and solve my pain or my pain problem. But what I've learned over the last few years is really just the idea that I've had sort of limitations and certain, issues in my lower extremity, call it maybe some limitations in my hips, or my feet being really stiff, or big toes being really kind of limited in their capability. And that's what I believe is creating this sort of damaged tissue or sort of pain on the heel. So I took a couple months off tennis, and I've been building the capacity back into my body through, daily balance work on the soulmate, or just doing foot and toe mobility. And it's really been cool to see. I still have the pain after I play, but it's a 2 out of 10 versus a 7 out of 10, and it's way less frequent. So just implementing that idea of being my own scientist and adding the right inputs has been, yeah, it's been really powerful, and it's been cool to sort of go on that journey. So those are the two case studies I can share. As far as like spreading this. Yeah, I'm in an online sort of entrepreneur group with other sort of fit pros, some physical therapists, some personal trainers, some health coaches. And my goal is,
6-minute warning, Nick.
yeah, cool. My goal is to share it with them and to sort of engage in dialogue and feedback, just as we're doing here, to try to sort of spread this to greater parts of the world. So that's what I got for today. Thanks everybody for being here, and I'll pass it back to you, Ruth or Nick.
Awesome. Thanks for sharing, Nick. Appreciate that. I'm going to go next. I'll make sure I keep myself to 7 minutes. So my name is Nick St. Louis. I'm trained as a physical therapist, and my current work is lead developer with Apollo, which is a open source lower body health protocol, and it's sort of the foundational project that best practices have stemmed from. And right now my work is as an advisor for Soul Freedom and the Foot Collective. So Soul Freedom is a Canadian natural footwear retailer. TFC is a global health network focused on feet. Practices that I do every day to maintain a healthy lower body. I do at least 21 squats every day before coffee. I know it's kind of a random number, but I like that number. It's stuck. Usually do more, but I do at least 21, and that allows me to get into a deep squat position every single day as sort of like a movement check-in for my lower body. I walk barefoot every day outside on texture, could be grass or rocks, and I go on at least 2 walks a day, and I don't own or wear any unnatural footwear. So those are the main things that I do every single day to take care of my lower body. The case I want to share is from a patient I had a while back while working in a sport medicine or rehab clinic. She was about a 50-year-old woman who was active and was having a lot of severe knee pain. And this really like burned into my brain because it was so profound. I asked her to remove her shoes for a movement assessment, and she told me that she can't move without her shoes and her orthotics because it will damage her feet. So I kind of double clicked on that and started asking her questions, and I found out that the advice of her podorthist was to never stand without her orthotics and her shoes. And so she literally had indoor shoes beside her bed, and when she got out of bed every day, she would put her shoes on inside. And her belief was that if she moved without her shoes, she would experience pain, and that pain would indicate that she's damaging her feet. And so, I kind of talked with her and said, listen, this is a safe space. The floor is flat. Let's just take your shoes off for an assessment. And if it's too painful, we'll just put them back on. So took her shoes off, shoes and socks. And we started moving and talking. And I think she kind of got distracted away from the fact that she thought her feet would hurt, and from the fixation with her orthotics. And 20 minutes of moving, I kind of asked her, she was barefoot. I asked her how her feet felt. And I could see this kind of look of confusion on her face where she was like, my feet feel really good. And, just by experiencing 20 minutes barefoot, which probably she hadn't done for a very long time, she sort of proved to herself that she didn't need orthotics all the time. And so, my application of best practices, before best practices were even a thing, was just starting with the idea that pain is a signal that you need to tune into, but it doesn't necessarily equate to damage. And for her, that was like a groundbreaking revelation, because now it meant that anytime she experiences pain, she doesn't go into fear mode thinking she's damaging her body. She realizes, oh, this is something I need to listen to and be aware of, but it doesn't mean I'm hurting myself. So that was even just that simple little nugget of pain education completely transformed her mindset from fear to confidence, to like being able to make use of this signal. I also explained to her that, wearing stiff, rigid shoes and orthotic inserts actually hinders the mobility and strength of her foot, is literally weakening her foot. And that was just very counter to what she had been told. And long story short, I saw her 2 weeks later, and she had hardly been using her orthotics. And frankly, she was a bit angry that she had been told that and kind of lived within that constraint for like a couple years. And at the end of the day, what we realized was this well-meaning podorthist that is trying to help her get out of pain, and probably these artificial supports helped her at some point experience less pain, ended up getting to a point where they weren't serving her and were counterproductive. And her just understanding that actually movement is what the foot needs, loading is what the foot needs, and transitioning to shoes that allow feet to adopt a natural position and allow feet to move naturally, allow all the 33 joints to articulate, allow the muscles to work to support the load of the body. And the notion that each day is an opportunity to just experiment with a little bit more load, whether that's a longer walk or more time in these natural shoes or less time in orthotics. You know, in a very short little span of time, we covered movement education, footwear education, pain education, the mindset that, you know, a little bit better each day is the goal. It's not a rush. This is the long-term goal of restoring natural foot function. And then using the squat as a movement screen to give her an indicator of how her lower body was doing. You know, that covers basically these essential practices that, you know, we're trying to codify into best practices that I think create a complete offering to ensure that she's not missing any critical piece of education that would stop her from really building confidence and taking more responsibility for her well-being. So I think to me that just showed that, you know, a little bit of pain education, a little bit of movement education transformed this woman's reality from one dominated by fear and dependence on external supports to be able to just function and live day to day, to a mindset where she now felt confident to make use of the signal of pain instead of fearing it. And she understood that the body requires movement and load to be able to restore itself back to these default healthy settings. I think, to me, that was just a really big light bulb to say, wow, I never learned about shoes in school. I never learned to describe pain in a really simple way, an empowering way in school. And I think, you know, if I look at all my peers and my physiotherapist peers from school, it's like they can just be so much more, we can be so much more effective by doing these very simple critical behaviors that can completely transform people's sense of empowerment with their well-being. And that just sort of reinforced this idea that what if we could, you know, create this checklist of education pieces that we can all cover in every encounter we have with a patient, and just, you know, exponentially increase our effectiveness, not because we're doing anything more complex or novel, but because we're just ensuring we do the critical things. So anyway, that's my talk. Thanks for listening. And next up is Chris Lipp. So Chris, it's all yours, and I'll give you a 6-minute warning.
Perfect. Thanks, Nick. And nice meeting everyone for the first time. So my name is Chris Lipp. I currently work in Calgary, Alberta, Canada. I've had a really exciting journey to come across TFC many years ago, and really excited to be part of the Apollo project and endorse that fully because I just see it transforming lives around me every day. My training is pretty extensive in the acute care world. I did a degree in nursing before going into medicine, and then after completing my medical degree, I focused for 5 years on my emergency medicine credentials. And then after that, I completed a fellowship in sports medicine. And currently, I sort of divide my time between providing really the acute care people need for emergencies in a large hospital center in Calgary. And I get a chance to really come alongside people on all strata of life, from young to old, and get to see a huge range from life to death and illness, disease, and even cases where I can help people promote their health and refer them to outpatient follow-up. Now, my main interest in the sports and exercise medicine world is focused on providing the best quality musculoskeletal care to patients, really focused on, I would say, many of the core pillars of what running Apollo is all about, really helping to primarily educate people about how their body, how it can adapt to injuries through them and actually become stronger, but also addressing the fact that most people live in a world where they are trying to manage pain and understand what the source could be. So it's really a privilege to meet people in all those different points in their journey and try to discover where I can come alongside somebody in parallel and really work with them to, if they're interested, discover what the root cause of their concern might be and hopefully rebuild it from the ground up. currently, that MSK work looks like working with people of all ages, and including some pro athletes in the city here. And it could range from diagnostics to injections to point of care ultrasound, imaging, referral for surgery, or what really is the passion is trying to help people learn how to take responsibility for their health. The case I wanted to share with you was a case that I'm still working with. It's a 40-year-old physician who came to me in 2023 with knee pain. And she was on the standard sort of disease care pathway where she was receiving injection therapies for her knee osteoarthritis in the background of having an ACL graft, and then having that being torn while she was snowboarding, and then dealing with chronic knee pain. In the course of our longitudinal relationship, we essentially identified some other issues stemming from pain in her foot, and identified that she had quite advanced or severe medial apex arch pain, and that was arising from severe arthritis in the medial cuneiform and navicular joint. Initially, coming alongside her main goals, which were to reduce her pain so she could reach some of her short-term interest in snowboarding, we sort of went down the pathway of cortisone injections followed by other injection therapies. And then as our relationship grew and as she was more interested in finding a long-term solution, we started exploring more ways that she could optimize her intrinsic foot strength and health. And that's where we were able to sort of start unraveling some of the disease care-oriented interventions she'd been applying to her life, including unnatural footwear, heavy reliance on orthotics, and sort of becoming out of focus from what she could do on her own to initiate a healing response and adapt to her demands. So that's led to focused intrinsic foot strengthening, focused removal of orthotics and unnatural footwear. And it's really exciting to see how she's basically experienced the systemic effects of natural footwear to the point where she's now exclusively wearing natural shoes. She's also noticed that her knees no longer cause her discomfort, as well as her hips no longer cause her discomfort. And she's been able to sort of get off the speedway or roadway of having recurrent pain-focused interventions in the knee to more focused pain-free activity in her proximal extremity, lower extremity, because her foot's stronger and moving more naturally. Furthermore, she's actually noticed that she's been able to incorporate natural footwear within her family, with her son and with her husband. And even the last visit, she commented how her husband is now on board, and he's noticed that his golf game has improved in terms of force transfer and power and better endurance and longevity when he's playing golf because of a more appropriate footwear. So that's been a big success story in my world. What I do daily is, since a lot of my work is standing, I try to make sure that while I'm flossing my teeth, I get inverted and basically decompress the lymphatics and veins in my legs. And then while I'm brushing my teeth, I focus on doing a knee to toe assessment every evening, where I can just see how my ankle dorsiflexion appears left and right, and symmetrically checking on that every day. That's all I have to share. Look forward to chatting with you guys more.
Awesome. Thanks for sharing that, Chris. Always great to hear success stories. I think, not every story will be a resounding success or like super obvious success, but I think over a long enough time period, it's hard to imagine how offering the body more natural inputs, and probably more importantly, eliminating the unnatural inputs people are unintentionally exposing themselves to. It's hard to imagine how that wouldn't help someone's body, sort of recalibrate these default settings of strong, mobile, resilient, stable. So thanks for sharing, Chris. And next up is Linda Ring. So Linda, it's all yours. I'll give you a 6-minute warning if you get to there.
All right, thank you. So hello, everyone. My name is Linda. I am a physical therapist by training, and I live in the United States in the Northeast. So initially I was, well, I worked in a rehab setting, and then I went to an outpatient setting, and then I did home care. And at the moment I'm in between. I am in between jobs and in between, I'm at a transitional moment in my profession, which is actually great because I've been working toward this for a while. So I'll go into that more, but let me just I'll follow the outline here. So something I do daily now to improve and maintain my lower extremity health is I get up and I walk the dogs outside for their first break barefoot. Not every day necessarily, but most of the days I do now. And I actually end my day when I take them out for their final outing. I also go barefoot. And just a side note, my daughter will come with me and she'll remind me, she's like, "Are we going barefoot tonight?" And I'll say yes. So we'll go out barefoot together to take the dogs out. So that's something that's a sort of a daily ritual. I get down in squats. I don't do 21 or any particular. I bet you, I mean, it does sound good that it would be good to put myself on a specific structure. But I squat down. I do my initial work of the day, either standing or down on the ground. So I've incorporated much more floor living. And, that, of course, puts me in lots of different positions naturally because it's not comfortable to stay in any one position on the floor for a super long time, certainly not as long as you can tolerate sitting in a chair. So that's something that's different for me for sure. And I stand on the soulmate, which, I just kind of stretch out my feet and I roll out my feet each day. So that's something I managed to incorporate on a very regular basis. There's always room for adding more things that are good for me there. But that's what I do so far. Now, as far as like case examples, so I've got a couple things. One that I've done, one is myself, myself as a case study, and then one is my intention. But a few years ago when I've learned I knew of the Foot Collective for quite a while now because Ruth and I are friends, and I saw what she was getting into, and I started asking questions about it, and going on the YouTubes and listening to what Nick and Ruth had to say and different people that they brought in as well. And it instantly just felt very aligned with how I've been feeling about what was missing from physical therapy. So I mentioned briefly the different settings I've been in, and I've found fulfillment and success to a certain degree in each of those settings, but I always felt like, I felt ineffective is what I felt, because I sort of tend to take things on and sort of look inward, like what could I be doing differently and what am I not doing that I could be doing to help people that are coming to me for help. And so I always felt like there was something missing. And when I started to learn more about the Foot Collective and the approach of foot health and, sort of overall health from the foot up, I realized like this just makes so much sense. But in my current role, which at that time was in the home care setting, I just still felt like there's so many obstacles because even though I started to incorporate it more in my own life on a much more regular basis in ways that people wouldn't see, but also ways that they would see, like changing all my footwear, etc. If I ended up in a discussion with somebody about, sort of how to approach a certain injury or impairment, or in general, maybe fall prevention or any of the above, I would run into the very predictable resistance, from a different mindset that everybody's sort of adopted just through time, whether it was in their own profession or through healthcare professionals that they have seen over time for different injuries. And, it's always in this sort of old way of avoiding pain, just looking at the symptom itself. To prevent falls, you have to have like really good, sturdy footwear on, but when you look at the footwear that they're, recommending for older people, it's everything that natural footwear is not, etc. So it was either resistance from in that way, just sort of a mindset, or it was resistance from just the system itself. So through regulations that are required in the healthcare system or insurance regulations, everything is dictated. What you can do and how much time you can spend with someone is dictated by that. And in particular, sort of circling back to what I said with people's mindset is in the home care realm or working with fall prevention, you're tending to work with people who are older and they have 100% belief in what their doctors are telling them. And, for the most part, those recommendations are, the things I've already listed. So if I told you, as a elder person, like, okay, let's take your shoes off, let's just see how you do, in barefoot around your house, I would be held liable for, as soon as somebody stubbed their toe or something, and came up across with a little cut on their toe, they would come back and bring it back to me. And then the agency I work for would, be in trouble, and et cetera, et cetera. So I just felt very limited and stifled and disengaged and unsatisfied. And so I'm, happy to be out of that sort
One
of.
more minute, Linda.
Thank you. Of the constraints of that system. And my intent is to create space for myself, create opportunities for myself to be able to share this knowledge with people in my community, with anybody who is interested in learning more about how they can empower themselves, with this new approach, starting with explaining a little bit of like first principles, just this is how our body works. Our body will adapt to whatever inputs we give it. And explaining a little bit about pain, how it's a very good input, feedback system for us. And this is what we can do about it. And interestingly, I have a friend who I used to work with, and she has had a lot of foot problems in the past few years, gone to podiatrist, had expensive orthotics, ordered for her. She's down to the point where she can have just one pair of shoes that actually feels good to her. And even that, at this point, about a year ago, she told me that those shoes would get her through the day. And I just saw her last week, and she said that actually, I can't go very long without foot pain now. And she asked me if she could work with me in a couple of weeks, when she got back from being out of town, to work on this approach, because we've talked about it before, but she was very nervous about sort of stepping away from what they were telling her. But she has seen, it's proven to herself over time now, that even what they're telling her isn't working anymore. And her next option, and only option according to them, is surgery. So my intent is to, put this to practice with her, and just explain to her and let her see naturally through her, things that she can do, how she can fix her feet and get back to a place where she's not limited anymore. So I'm really excited about that.
Awesome. Thanks for sharing, Linda. Maybe on a future call, you can fill us in on how your friend's doing. And I think pain is the ultimate catalyst for change. I think in my experience, there's been times where I've been rigid in how I think of something, and, pain just ends up being this strong force to convince me to be more open-minded. And, even the most stubborn or inflexible person in their thinking will come across an opportunity to change their mind when pain nudges them hard enough. So yeah, curious to hear how that goes. Our last speaker is Kate Powell. So Kate, the stage is yours. So I'll give you a 6-minute warning if and when you get there. And yeah, go for it.
Thanks. Yeah, so I'm Kate Powell, and I am currently in the Mid-Atlantic in the US. And yeah, so I would say for my own foot health, I walk twice a day. I've switched over to all natural barefoot, approved footwear. I've been working more movement breaks in standing more when I work. I didn't used to have to worry about that. I used to be more of a yoga professional and like a yoga teacher, and I've farmed for many years. And so shifting, I do most of my work. I forgot to say this, so I'll go back to it in a moment. But yeah, I do most of my work online at this point. And so that's definitely been a huge change. And I noticed my body starting to have pain in ways that it never had before. I'd been a dancer long before all of that. So I've always been a big mover. And so, yeah, I was like, whoa, what, like, I don't think I'd ever experienced that before. And then when I, especially during the pandemic, and yeah, I switched, I was just sitting a lot more. And even though I was trying to sit on one of the, the large medicine balls, and, it was still just a lot of, yeah, a very different lifestyle. And I was noticing my body was really showing the effects of that. So I've been trying to work more standing and movement breaks back in, and going for walks, and then also working more yoga and like training back in, although I would be lying if I said that we're daily currently. So yeah, in terms of what I do, so I work more in what some might call like really traditional health, kind of medicine woman or shamanic approach. So I'm really working at the level of the intersection of sort of spirit, soul, mind, emotions, body, and then also culture, and what Nick St. Louis was saying about kind of changing the water in the goldfish bowl. I think of that as, a lot of times we think of culture as art or, dance, some sort of like expressive practice of the culture. Maybe we think of it as food, but really culture is the water we swim in, and it's our mindsets and it's our beliefs and it's our expectations about what's possible. Those are just as much a function of culture. And we have kind of this inner and outer culture. And so I think of it, I work within the subtle body, which is sort of the aspects of our experience that are not necessarily the ones, the tangible, the gross body, the physical body. So it's where those pieces meet, where our thoughts and emotions and nervous system and sort of maybe spiritual lessons like all meet in our body and are stored in our body. And so culture is also, it's kind of like the energy fields are kind of like the petri dish. And so whatever is stored within those fields influences how our physical cells know to organize themselves and how to grow and how to express. And so I really passionately believe in sort of this idea that we have to really tune into what is the culture that we are not only creating in the world through our actions, through what we're creating, but also like how are we living out the culture within ourselves too, and then in our relationships. And are we living out cultures that are more dysfunctional, or adaptively functional? Or are we living out cultures that support more humanity, less dehumanization, that support more aliveness, rather than sort of this like numbness and kind of this walking death that we're kind of seeing? Like, yeah, I feel like I'm seeing on an epidemic. And, a lot of clients find me, many of them have been in therapy for 20, 30, 40 years. And it started off being really helpful for them. And then they're at this point where they're like, but why does everything still hurt? Why does everything still feel bad? Why do I know better, but I'm not necessarily feeling better, or I'm not necessarily experiencing any actual shifts, And the lower part of the body is very connected, where things that are related to family, to sense of safety, to our relationship with the idea of nourishment and whether or not we feel nourished and whether we feel like we have what we need. All of that gets stored, our relationship with our family and the people who matter most to us, all of that often gets stored in our lower bodies and in our feet. So it's kind of in sort of this understanding, this more shamanic understanding, it's the idea of like a lot of our human walk, kind of what it is to be here in this life, in this body, moving through the world, that all gets stored kind of usually for the most part in our lower bodies. So when people are having pains that can't seem to be addressed elsewhere, often there are these other components, and that's where we start to kind of look. And so, for me, one of the things I've been hearing a lot as people have been speaking today is kind of this that we've sort of been dancing around, but I'm wondering if it would be helpful to put it explicitly in the paper, is that we actually need to shift the metrics, I think. Like, what are the metrics of success? And, it's obviously going to be different with each practitioner, but I think there's this piece around, and we kind of touch into it when we talk about pain and mindset and, but there's, I think some of what we have to educate people for is that, the success looks very different perhaps, or than how we've culturally been taught to think about success. And so I feel like that's a piece. And then even within the mindset piece too, I'd like actually love to hear something within the paper that specifically mentions that we also have emotions that get stored in our body if they haven't been expressed, or trauma. And again, not that every profession or every approach or modality would have the scope of practice to navigate that, but I think educating people that that's some of what's coming up is really important, because that's something that just does not get talked about a lot.
60 seconds, Kate.
Yep, thank you. And so, and then I think the other piece that I'm not totally sure how, but again, we've kind of been touching on it throughout what I've been hearing people speak, is as practitioners, it's also not just about what we do. I think we can do all the right quote unquote things, but we are not necessarily, it's like how we're relating to them and how we're relating to our clients that actually makes the most difference. And so when we're in a place of curiosity and compassion with them, that teaches them how to be in a place of curiosity and compassion. And so I'm wondering if there's also certain qualities, not just like how are we applying these best practices as things to do, but also how are we embodying the qualities necessary for healing or transformation or some kind of reparative work to happen. And so, yeah, those are the kind of the main points that, yeah, these little pieces that I feel like we're touching on, but maybe could even be brought out more explicitly to strengthen the paper and the best practices.
Awesome. Thanks, Kate. And yeah, I think for each, the paper, the best practices paper, actually, even before I say that, Tabor, I don't know if you want to speak or share. We did have a podiatrist, Andy Bryant, who was supposed to be on the call, couldn't make it. If you'd like to speak, you're more than welcome to. The framework is your name, which country you're in, and your profession, and then share something you do to take care of your lower body, and then share anything related to best practices in your own work. So no pressure, but I just wanted to extend the invitation if you're interested. If so, I can kind of time you, and you have 7 minutes to speak about whatever you like.
All right, thanks, Nick. And I appreciate all the feedback you guys have given thus far. My exposure to best practices is just beginning, and so excuse my naivety. I am located in the southern states currently, and my background is in prosthetics and orthotics, specifically in prosthetics for limb replacement. And so my exposure to patients is more of the extreme aspect, following, from the beginning with a compression stocking to diabetic footwear to diabetic offloading devices to amputation. And so it has developed within me a passion for care of the lower extremity, and a recognition, realization that there's a bit of lack of understanding and there's a bit of lack of personal responsibility. And so that's kind of what's driven me. As far as a personal care on a daily basis is barefoot walking, the stretching. I do like the addition of the squats, and that's something that I'm going to add to it. And I think just, having those personal interjections of this is how I care for myself is inspiring to others. And so thanks, Nick, for that. The question, I guess, that I have is, how do we inspire and equip those who inspire? How do we inspire and equip those patients under our care? And as a care provider, there's this breadth of issues that you're dealing with. And so it's a bit of a focus on, is there something that ignites this fire within an individual to tend towards personal care and to remove all the onus of their well-being and their care from the care provider to the individual? And I'm not sure what it is for you guys, but for me, it's kind of trying to distill that down for the individual patient and, understanding, okay, is there a spark that I can ignite to aid them? Or is there a damper that's putting out the spark, which is destabilizing their ability to progress and to take on that personal responsibility? And those can be, I think, from my experience, distilled down into different sections of Footwear is one that I'm passionate about and love. It's this spark that I have seen ignite in people, and their ability to kind of begin to take a bit of personal responsibility. It's this opening of their eyes to the impact of their choice on their body on a daily basis. And then I've seen the opposite as far as, something as simple as footwear can be the detriment to their ability. The lack of knowledge and information can be what impairs them on a daily basis. And so my candy stick is always, starting with something that is changeable, something that they can personally take on without it overburdening them. And for me, that thing is footwear. So that's my input.
Brilliant. Thank you very, very much for that, Tabor. Yeah, I think there's just such a big opportunity for us to sort of reimagine what it means to help people with their health. And, for a long time, I would have said, well, I want to help people get out of pain. That to me was helping people with their health. And the notion that, well, actually getting out of pain, if we over-index and optimize strictly for pain, it can actually lead us to do things that are counter to health, right? That are just indexed for reduced pain, even if that means the long-term outcome gets them further away from health. And it really gave me this deep-seated sense of discomfort that, like, wow, I want to, and I think I'm helping people, but now I'm realizing that, well, perhaps I'm not being as effective as I could be. And just the notion of going outside of my formal training, and thinking from first principles, starting with myself. And I think one of the big things with, all the people, and obviously everyone on this call is an outlier, probably compared to the average person in each of our respective professions, because we're here and because we are willing to put our time and attention and energy towards this thing, this endeavor to spread best practices as sort of like this baseline standard of care. But I think one thing that Kate brought up, which maybe is a good sort of topic to put out there for discussion, is this notion of culture and this idea that it's all well and good to give people the awareness and understanding of the impacts of the shoes they choose to wear on their foot health and lower body health. But it's another thing to, butt heads with this culture of wearing shoes that look good, wearing shoes that are worn for the aesthetic or the fashion element, and having that be in direct conflict with this aspiration to achieve better health, and I guess what I'm trying to say is sometimes I think it just takes enough pain where people are willing to change their minds and maybe go against the culture, this set of beliefs and ways of living that people have just grown up in their entire lives. Sometimes, in my experience, it just takes enough pain for people to want to have the courage to veer away from that norm, and say, you know what, I don't care what my feet look like or what my shoes look like. I literally just want to, I understand the importance of restoring my health because I want to do activity X, Y, Z, or I want to be able to play with my grandkids. And Tabor, the one thing I would add in terms of how do we ignite the fire in the people we work with, for me, it's always been trying to spend a good amount of the initial time with someone who I'm starting to work with, really trying to dive into, like, why do you care to work on this? Like, it's going to take effort and energy and sort of like this, daily commitment to doing something to upgrading your body to make changes, which change is hard. And to me, it's always been like, what is their why? Like, what is the reason for doing this? And if it's just, I want to get out of pain, that might be a strong motivation now, but what about when you're out of pain? Like, are you still going to be motivated to make changes or work on things? And so I think really helping people get radical clarity on their why, of like, what is their really deep-seated reason for actually wanting to meaningfully improve their health? When people get clear on that, to me, that's always supercharged their motivation to actually do the hard thing and make the changes. So I guess I'll just open it up. If anyone has anything they want to reflect on, or any point of discussion, or more importantly, maybe any questions about best practices. No question is a bad question. So I'll just open it up, and we got, let's go 15 minutes of just like an open forum discussion. If anyone has a point to discuss or a question to ask, go for it. And thank you to everyone who spoke and shared. I think not only very grateful for your time and energy being here today, but also just the willingness to share. And yeah, I think this only happens because people are willing to be here and share. So thank you all. And yeah, if anyone has anything to bring up, go for it. Go for it, Kate.
Yeah, well, I love what you were just saying there, because I think, well, first off, I think that, helping people, I think for me, that's some of what I was trying to get at with sort of this metrics shift too, because once we start getting into some of these things on the best practices paper, we're starting to get into things that become less overtly measurable for people, right? And like, I struggle with this. Actually, struggle might be a strong word, but this comes up a lot in my work, where people are like, wow, I guess I do just feel like my quality of life has somehow gotten better, even though I don't always like feel better, right? And so I think that's the piece that, but it's, pain is like sort of a somewhat quote unquote easy thing to, I mean, even though it's still subjective, you can say like on a, scale of 1 to 10, right? But like, it's harder to do that with like on a scale of 1 to 10, like, how good are you feeling even if you are in pain, or how, so I think helping people tap into their why, like, helps them find their metrics for success, which is like really key for having people stick with it. And also I think for changing cultures to things that are more like, what are the metrics of aliveness? Like, how are we actually measuring how alive we feel? Because I think that's the measure of health, because we know that aliveness doesn't always feel good and isn't maybe always 100% free of disease and or pain and or injury and or trauma, so I was gonna say, yeah, that, and then, oh gosh, there was another piece to that, but it's gone out of my head, so I'll come back around again if it comes back.
No worries. I think the notion of leading by example too is something that, again, in my physio training, it was always, these are things you tell your patients, but there was never a mirror put on us. I mean, if we even just looking at the format through which we learned, this physical therapy program was all spent sitting in chairs. And we never moved together, apart from moving from one classroom to the next. And so I think this transition from disease care to healthcare, I think actually just begins by leading by example. I just recently became a father, and what I'm really learning in a strong way is that my daughter learns from what I do. And she can't talk yet, but I'm sure that whenever she can talk, she'll learn a lot more from what I do than from what I say. And I think this idea that if we are living in alignment with what we're sort of teaching and educating our patients, that probably will be way more impactful than what we say. And I remember when I worked in the sport med clinic, everyone was barefoot all the time. And it immediately created a topic of conversation where patients would come in and be like, why aren't you wearing shoes? And it just led into this natural conversation of, well, I don't wear shoes so that my feet can function naturally, because they function best when I'm barefoot. And if I do wear shoes, these are the kind of shoes I wear. And it's to me, that's a very different dynamic than saying you should wear this type of shoe. And instead being like, I wear this kind of shoe because, and that's the kind of shoe I recommend to people that I work with, because I've experienced the benefits firsthand. And I think speaking of it from a theoretical perspective is very different than speaking of it from an experiential perspective. And I think it just creates this sense of integrity where it's like, oh, this person's not just telling me what to do. They're sharing what they're doing, and they're doing what they know best how to do based on their understanding. So it's like there's always been this sort of conflict where I think some professionals find it hard to talk about natural footwear because they don't wear it themselves. And so speaking about it while you're wearing unnatural shoes in the place of work is sort of like, it creates this weird dynamic that's a bit out of integrity. So I think just leading by example is how we learn the most about these practices and about our bodies. And yeah, to me, people who are practicing what they preach are really going to be the future of healthcare. And I think that's just that really is just a foundationally different culture than what I have been exposed to in my sort of career as a disease care professional. Chris?
Yeah, my thoughts with next steps would be I feel like many people I see I see and assess them, and their priorities are different than mine. And there's often a big disconnect between what they want and what I think is best for them long term. And coming alongside them is always tricky because we have time limited appointments and can't spend 4 hours, and people don't want to spend 4 hours with me either. So trying to find a balance between what I know and what they're experiencing. So one of my proposals is maybe to think about putting together like a best practices lower extremity questionnaire, like an intake questionnaire that we would give to patients or be available for them. And that would sort of explore some of the different questions that were very kind of thoughtfully put together on the Apollo GitHub website, because sometimes it's those moments of reflection and quiet as people are approaching us or coming into the clinic, or even following up with them, we can sort of start unraveling some of the narratives that they've been ascribing to most of their life. And then hopefully focusing on the readiness for change and in which area we might cover. For example, it might be, rather than natural footwear, initially, it might be discussing mindset or pain, etc. And that would be my suggestion, is think about how we can put together an intake questionnaire for people and meet them where they're at, and then assess where to go from there.
I think that's brilliant. And yeah, I think that's, the Apollo project is all about trying to have dialogue with professionals to see like what tools can be useful and helpful, and what tools can we put time and energy into creating. So I think that's a really good idea. And even like one thing that is on the docket to build as well is just a one-page checklist for health professionals, to give them a quick access to sort of like, just a checklist style paper that allows them to sort of make sure they're touching on all these elements in their initial intake. But I agree. I think the idea of having people be able to fill out an intake survey to, I guess, help hone, like you said, help hone in on where is the biggest opportunity right now, which a lot of it is kind of tied into within which domain is their readiness the highest, so that there can just be less friction in kicking off the first domino of them feeling more empowered, more confident, or even just identifying blind spots. Like the idea of being able to put a lot of time and energy into thinking what are the right questions to ask, and having dialogue around professionals weighing in on that to craft a tool that then everyone can use and that can evolve over time is great. So thanks for that suggestion, Chris. And by next call, there'll be something created preliminarily that we can all kind of like critique and weigh in on and contribute to. So thank you. Linda?
Yeah, I just wanted to say that I 100% agree with Chris. I think that's a really, really good idea for that questionnaire. In the work that I've done in the past with fall prevention and working with a lead researcher in the area, I learned from her that people need to hear the same message more than once. And the reason why, or one of the reasons why, is because in order for them to accept or adopt a new way of thinking, to do that, it's almost, you have to sort of admit, at least to yourself, that what you have been doing isn't working for you. And there's a lot of, there's internal resistance with that. So people tend to need to hear things, far more than once. And I think if you had an intake questionnaire, it would sort of introduce some of this in a way that you would be able to say, see how you answer. This is what we can do with it. This is what that means. This is how I would approach it. It sort of engages them more and gives them some more tangible things to relate it back to. So just based on my experience with the fall prevention stuff on how to, get education across that we know has been tested, and, approaches that we know can help them, people need to be willing to admit certain things about themselves and accept, it on that level in order to then push through and hear what you're saying. And so I think that this would be, you know, a good way to get some of that going, you know, as sort of another layer, an initial layer before you even have a conversation with them.
Agreed. And I think if done well, the questionnaire is not just a one direction, it's like a bi-directional tool where it can be used to gather information and data about a person and how they're thinking about things or where the knowledge gaps are. But it's also kind of an education tool, right? Like each question that's asked will get a person thinking about their answer. And just the fact that they're putting, you know, brain time on this topic, thinking about something maybe more deeply than they had before is a touch point for them to understand that this is actually, you know, if the question is being asked of them, it indicates that this is an important thing to think about. And I think even from that standpoint, it could be an education tool for patients as well. Anyone else have anything to bring up for discussion? So I don't have to belabor it too much, but I wanted to just touch on it, this notion of building consensus. And, you know, this idea of replacing truth by authority with truth by consensus is essentially this aspiration to say, okay, we don't want to just appeal to authority and say, this is true because this person said it was true. I think the way we build power and strength and confidence in best practices is by having professionals signal that they agree with and validate the effectiveness of these fundamental practices. And so the path we're taking to do that is just formalizing the process of professionals essentially putting their name, putting a stamp of approval by submitting an endorsement, which is implicitly saying, I agree, I understand best practices, I agree with them, and I validate that they are critical practices for effectiveness. And that's all sort of baked into this simple thing of endorsing it. And right now as of August 21st, we have 14 professional endorsements. And our goal is to just continue growing that number over time, because I think when we get to a point where at 50 or 100 or several hundred endorsements, it creates a more potent signal that is harder to ignore, I suppose. You know, this idea that if best practices are sent to a professional and you know, they see that these best practices are endorsed by 100 lower extremity health professionals from a variety of different disciplines, it gives power that maybe this is something that is worth a read, right? This one pager might be worth a read, and maybe showing up on a quarterly review call might be worth their time. If 100 people are signaling that they validate the effectiveness of these critical practices, you know, I think there's a big opportunity to just get it into the world across all different professional domains, and build power and build truth by consensus instead of just by authority. And I think that's sort of this roundabout way where we don't necessarily have to go the academic route or have research done. It's more just, you know, these are just essentially putting it at these are critical practices that we all as a community of health professionals agree should be in some way applied by anyone who is working as a healthcare professional in the domain of the lower extremity. And it's not to say anything about how they should be applied, or they're not prescriptive. They're simply describing these, just like the building code describes these fundamental things that must be included in a house. Like you need a foundation, you need a roof, you need to have, you know, electrical wires, you know, behind walls so that no one's getting hurt. It's like really just saying, you know, if you're not giving people some foundational education about movement and pain and footwear and the mindset of developing better health and doing some basic movement screening, even if it just means watching someone go down to a squat and seeing what you can see, then maybe you're missing a critical element that can allow you to be more effective. And I think building consensus is just the path of disseminating this information into the world of professionals and then getting their feedback as to whether they agree or not, and building sort of these formal endorsements as an indicator of the amount of people who are signaling that this is true, valid, and worth talking about. So I don't know if anyone has any questions or thoughts about this, the process that we've chosen to use of professional endorsements, or even feedback on the process that we're using right now. You know, the form, the clicking the button. You know, it's by no means perfect, and we're at the very start of this kind of mission to increase awareness and build consensus. But if anyone has feedback on that or anything to share, go for it. Okay, well, that kind of wraps up our first call. Thanks again for everyone. Your time and attention is scarce. We appreciate the fact that you decided to be here today and to share. So our next quarterly review is going to be in December. So it's December 18th. We're going to do it a bit later in the day, 4 to 5:30 Eastern time, to accommodate Australian participants. And our goal is to get different speakers each time. So, you know, I would imagine there'll be repeat speakers eventually, but I think the more perspectives we can get from a bigger variety of specialties and professions, you know, the label of lower extremity health professional is just this very broad umbrella term that can describe dozens and dozens of specialties. And I think the more different perspectives we can hear from, the more of a, you know, just a more well-rounded understanding we're going to develop. So, Ruth?
Yes, I wanted to just close by saying, can we do the same thing that we did when we started, which is to come on to video, and then what I was hoping to do is take a group photo. The only problem is I don't know how to do that. So I wondered if anybody, I think I could probably take a screenshot or something, but can we take just a group photo? And then this would be the time we are going to post this conversation because it's being recorded. So we are going to post it so other professionals can listen to it, as well as turning it into a podcast. So I just wanted to get everybody's approval or objection if your talk wanted to be edited, want us to edit out. So can we do any and all of those things?
Yeah, so I think the easiest way for that is if you do not want your part or your name to be posted publicly, just say it now, no judgment. So we'll give it 10 seconds. If no one says anything, then we're cleared to post it. And yeah, anyone who's thinking of being on a future call, I think being able to send them this call so that they can see the format and sort of and get up to speed, I think will be good. So speak now or forever hold your peace. All right, I think we're good.
Amazing.
Let's go video on real quick, take a screenshot, and then we can say goodbye and go from there.
Are you taking the screenshot, Nick?
I'll take it. I'll take the screenshot.
Amazing.
Command Shift. All right. 3, 2, 1. Beautiful. All right, everyone. Wishing you all a great rest of your day. Thanks for being here. And everyone has my email, nick@thefullcollective.com. So if you have anything to say or share, get in touch. And we will put the intake survey as something to work on with the Apollo team. And we will 100% have a version 1 or a preliminary version of that survey so that we can work with it and give feedback by the time we have our next call, probably before. So yeah, thanks again, and ciao for now.
Thank you, everyone. Bye.
Thank you. Bye.